Aloha! I'm Dr. Daniel Vickers, President of Discovery Chiropractic Hawaii, and I'd like to thank you for taking the time today to watch this presentation on diabetes. I've lived on Maui for 23 years, half my life now, and for 11 of those years I've been a chiropractor. Now I practice right here in Kahului. I also consult with a group of more than 1,000 doctors nationwide, some of whom you can find at www.lifechangingcare.com. I'm here today to talk with you about diabetes, something I know a little bit about since that's what killed my dad. But we'll talk more about that later. Diabetes, according to the American Diabetes Association, is officially diagnosed when your 12-hour fasting blood sugar or blood glucose levels is measured at 126 or higher on 2 separate occasions. Between 100 and 125 is called insulin resistance or prediabetes. Ideal or optimal level is between 85 and 99. So, what does seeing a chiropractor have to do with blood sugar levels? Well, I'm going to show you here shortly. The first thing that I want to tell you is that I'm not going to tell you to stop taking your meds. That's a decision you have to make with your MD or endocrinologist. Many of you may be on metformin or glyburide or glucophage or something like that. Keep taking those meds, but what I'm going to share with you today are some ways you can lower your blood sugar levels, and this is important because your brain and nervous system needs 2 things to survive: fuel and activation. And your brain runs every function in your body. Fuel is oxygen and glucose. Oxygen we get from the air that we breathe. Glucose comes from the food that we eat. And if your glucose levels are screwed up, you can have some serious complications if you're not addressing this. These complications can include blindness. In fact, diabetes is the #1 cause of blindness among adults in this country. It can also include amputation of a gangrenous limb or 2 or more. That's what killed my dad, but I'll tell you more what actually killed him some other time. It's something you should know about. So diabetes is a condition to be taken very, very seriously. It's not anything to mess around with. Here in Hawaii, we have one of the highest per capita rates of diabetes of anywhere in the country. We also eat an awful lot of Spam and drink a lot of soda. Any connection? So, what is it that makes me different from every other doctor you've seen? What makes me unique? Well, here in my office, we're going to treat you not just chiropractically, but also metabolically and neurologically. These are all important when it comes to blood sugar levels. Now, if you're watching this video, it's because you or someone you know is diabetic. I'm here to tell you tonight that we will leave no stone unturned when it comes to getting to the bottom of your problem. So, let's talk about the metabolic protocols. Now, one thing I'm going to tell you is that there are lab ranges, which are very broad, and then there are optimal ranges, which are a lot more narrow. For instance, it used to be that the lab range for blood sugar went from 70 to 115, and you were considered normal if you fell within that range. It's since narrowed down a bit, but optimal levels for blood glucose are 85 to 99, as I mentioned before. So you could be lab normal, but still be outside that optimal normal range. So the first thing we want to do is to get a complete metabolic panel. That's going to show us the fasting glucose level, as well as a bunch of other things that we need to look at. We want to look at a lipid panel. We want to look at a thyroid panel, because your thyroid runs your metabolism. And then we want to look at a CBC. That's a complete blood chemistry with autodifferential. So we separate the red and white blood cells. Very, very important. Why do you need this? Because these tests allow us to assess your thyroid, your adrenal glands. These are the stress glands right above your kidneys. The adrenal glands have a lot to do with your blood sugar levels. And if you're not checking the adrenal glands, then we're not getting the whole picture. And I'll show you how we test that. We'll also check the function of your liver, your kidneys, your red and white blood cells, and your gut function. All of these internal functions can be affected when it comes to diabetes. That's why we got to check them. So the next thing we do is sensitivity testing. Are you sensitive to gluten? That's found in wheat, rye, barley, oats, and some other grains. If you're sensitive to gluten, and every time you eat gluten your blood sugar spikes, then guess what? You better not be eating gluten. The only way to find out if you're sensitive to gluten is to do the testing. So we check to see if you're sensitive to gluten, milk, soy, eggs, or yeast. If you're sensitive to any or all of these, that's affecting your blood sugar levels. You'll have problems getting your blood sugar levels down, And even with the meds they give you, and your blood sugar goes up, and your insulin, and you need to get the sensitivity testing done. Here are some of the symptoms of sensitivities. You can have chronic pain or fatigue, frequent indigestion or bloating after eating, frequent loose bowel movements or constipation, or going back and forth between the two. And you can have sores or ulcers in your mouth, or maybe a tendency to vomit often. Next, we'll do an adrenal stress index, or ASI. The ASI measures your adrenal gland functions. Again, these are your stress glands. They sit right up above your kidneys. We test them with a saliva test. You spit into a vial at 4-hour intervals at 8 a.m., noon, 4 p.m., and about 10 o'clock at night. This is going to assess the function of your adrenal glands, because if your blood sugar levels are skewed, then your adrenals are coming into play and their function needs to be addressed. If you wonder why your blood sugar levels are through the roof and you can't get them down no matter what you try, then your adrenal glands could be part of the problem. We'll also look at immune panels, because you could be autoimmune. Your immune system could be attacking some part of your body, your kidneys, your adrenals, your pancreas, your nervous system. The only way to find out is to check your immune system. If your immune system is attacking part of your body, we run the immune panels and find out. Here's the deal. There are two parts to your immune system, Th1 and Th2. And we measure each of these, and we look at different markers for them. The markers for Th1 are interleukin 2 and TNF-alpha. These are blood tests. If interleukin 2 and TNF-alpha are high, then you're Th1 dominant. That needs to be addressed, because that is affecting your blood sugar levels. And if you're Th2 dominant, we're going to see higher levels of interleukin 4 and interleukin 10. So, if interleukin 4 and interleukin 10 are high, then you're Th2 dominant. Now, Th1, these are the T cells. These are the warrior cells that go in and fight and then clean up afterwards. They attack whatever's attacking you and then clean up the mess. You have helper T cells, regulatory T cells, natural killer cells, cytotoxic T cells, and macrophages. These are our first line of defense. The Th2 part of your immune system are your B cells. B cells make antibodies. B cells tell the T cells what to go attack. So that's what's happening with Th1 and Th2 dominance. And we don't know until we test for it. Then, once we determine whether you have an autoimmune disorder, and whether it's Th1 or Th2 dominant, then what's causing the dominance? It's caused by one of two things, either an antigen or a problem with dysregulation. Antigens are parasites, bacteria, toxins, food particles, virus, mold, yeast, fungi. Food, that's why we check the sensitivity, and it can be chemicals or heavy metals. And the best indicator for an active antigen as a cause for your abnormal Th1 or Th2 dominance is the helper-suppressor ratio, also called the CD4-CD8 ratio. If it's 2.5 or above, then you have an active antigen. If it's 1.2 or below, then you have a problem with dysregulation. What does this mean? Well, it could be an anemia, it could be your adrenal glands, it could be gut function. Whatever it is, we have to get to the root of the problem. So what I'm saying, and what I keep saying, is that we need to be as thorough as possible with the testing. Another problem could be H. pylori. Helicobacter pylori is a bacterium that affects your gut function, and it's been implicated in the formation of stomach ulcers, and it can also act as an active antigen. Your problems could be caused or activated by a leaky gut syndrome, or LGS. That's a condition of altered or damaged bowel lining caused by any number of things. Could be antibiotic use, could be toxins, poor diet, parasites, or infection. We may also look at brain and neurotransmitter levels. These are the chemicals that carry messages in your brain. If they're out of whack, then your brain can't control functions like your blood sugar. So, we'll also look at hormones. Hormone panel will tell us if your hormones are off, because hormones can cause alterations in your blood sugar and a whole lot of other things. And again, we don't know unless we test. I will say this, if you have a hormone condition or anything else, along with an autoimmune condition, then the autoimmune condition trumps everything. Everything. Until we address that, nothing else is going to get better. We'll also want to look at your markers for inflammation. These are C-reactive protein and homocysteine levels. So how do we assess these problems? Well, we're going to address them metabolically, neurologically, and chiropractically. And I use a number of innovative protocols in my office, including glutathione. Glutathione is your body's most potent antioxidant. However, it's not well absorbed in pill or capsule form. So that's part of the metabolic side. Then there's the neurologic side. Like I said, your brain needs two things: fuel and activation. Fuel is oxygen and glucose. We handle the glucose with the metabolic side of things. Now we want to deal with the oxygen. So we use exercise with oxygen therapy. It's called EWAT. It's fuel with activation. We get you doing upper body exercise with weights or a pulley system, or on a UBE, it's like a bicycle for your arms, while you're breathing in oxygen. Among other things, this helps your body regulate your blood sugar levels. Then we may use some brain-based therapies, depending on what we find on the exam, if there are any neurological deficits. Whew. Well, that's a lot of information. Sit back, take a breath, and ask yourself these questions. How has your diabetes affected your job, your relationships, finances, family, or other activities? What has it cost you in terms of time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 3 years if you don't get your diabetes under control? There are serious complications with diabetes. What is it worth to you if we can improve your condition? And I ask that because if you are diabetic and you're, say, gluten sensitive at a level of 50 on a scale from 1 to 10, which that's the normal range, and you're telling me you're never going to give up gluten, then don't even bother coming into my office. If you're not going to be 100% committed to getting well, don't waste your time, your money, and my time. I'm not trying to be rude here. I'm just trying to get the point across that I take this very, very seriously. Now, here's my offer to you. You're welcome to come in. Bring in any existing lab work you've had done. I'll review that. Fill out the paperwork that's included in this packet with this DVD and bring that in. Yes, there's a lot of information. Make sure you complete it fully, as this gives us a very clear picture of where we're starting. If you're watching this online, contact our office at 808-873-9221 and request a packet of intake forms, or email us at dcmaui@yahoo.com and we'll get them to you. On your first visit, we'll take you through our comprehensive neurological and chiropractic exams, give you a session on the UBE or other exercise protocol, along with the oxygen therapy and one other modality, and we'll schedule your second visit. On that second visit, I'll have determined whether or not I can accept you as a patient, and we'll go over the results on the exams and what the findings mean. At that time, we'll also go over your options for care and your financial responsibility. Normally, for these two comprehensive visits, I charge $250. Because you've taken the time to review this video and because you're serious about getting well, I will cut that price in half when you call to schedule your appointment. And these two visits will cost you only $125. Now please note, this offer is only good one time. If you schedule an appointment and don't show up, it's going to revert back to that full price of $250. So please, if you're serious about getting better, please call us today at 808-873-9221. We have only limited times available for these special appointments. So please call us today and get scheduled to get back on the road to health. I'm Dr. Daniel Vickers. Thank you for watching, and I look forward to helping you. Aloha.